Turn it over to Ranking Member Gillibrand.
I'd like to defer my time to Senator Alsobrooks.
Good afternoon. First of all, thank you to Chair Scott and to Ranking Member Gillibrand for convening this really important meeting. I am enthusiastic about joining the Senate Special Committee on Aging and really pleased to be here today. I want to thank all of our witnesses who've come today. Thank you so much for your presentations and your work and all the information that you shared. As the daughter of two aging parents, I have witnessed, like so many, some of the challenges that our seniors face. Our seniors have spent their entire lives, many of them, working to earn benefits such as Social Security and Medicare. And I view these programs as a promise that we have made to our seniors. I am committed to ensuring that every senior, regardless of their background or circumstances, has access to resources and opportunities that they need to thrive. And with that, I'll begin my questions. I'd like to say to Ms. Alvarez, direct the first question to you, that like so many Americans, I'm a part of what they call the sandwich generation, which means that I am both caring for a 19-year-old daughter as well as my aging parents. And while I'm really grateful for the opportunity to support my parents and understand the rewards that come with caregiving, I also recognize how challenging it is to bear the full weight of caregiving responsibility. Now, we know that many federal programs that are so critical to our seniors and that guarantee the support and stability that they need are really in jeopardy. And so in Maryland, we have over 1.2 million residents who are over 60, and the Maryland Department of Aging oversees a range of these programs. But Maryland also relies heavily on federal funding. And so I wonder, do you believe that volunteer-based organizations who we rely on very often have either the capacity to adequately fill the gaps that would be left by reduced federal funding? And do you believe that these organizations likewise have the obligation to provide that care, particularly in states like Maryland, where federal programs are vital to seniors?
Hello. Okay. Thank you very much for that question. So to answer your question, right now, if there's a reduction, if things stayed the same, if the funding stayed just the same, just by the fact that we have a larger senior population and more aging in every single day, there are 10,000 people who turn 65 every single day in this country. So with no increased funding and more people to serve, that constitutes a cut. So just starting from that point, I would say that we can't afford not to increase the funding. Decreasing it would put us in a crisis. And then when you're talking about the mission of organizations that manage volunteers, that's their mission. And my organization also, we're volunteer-based as well. And it's our mission to do it. And however, being realistic, we have to be able to marshal our resources effectively so that we can do a good job and be responsible in our work. With less funding, or even with less funding, it's not possible, right? We are constantly thinking of ways that we can get more people, because there are people out there who are very well-meaning and who want to do the work, but we also have to have the wherewithal to administer all of this work with volunteers coming in, as well as the job at hand, which is an increasing, senior population.
Thank you. And next, Dr. Carr, I just have a question also for you. And the question is regarding the cost of increasing of prescription drug medications. This is yet another area where I have seen really so much struggle. As I mentioned, my parents, my father is my mother's caregiver. And one of the things I note in Maryland is that, and around, is that nearly 90% of all of our seniors take prescription drug medications. We also know that over 20% report that it's extremely difficult to afford those medications. And we know that access to affordable prescription drugs is not just about health, but it's about dignity as well, and peace of mind. So the question is, how can we ensure that our seniors will have reliable access to affordable prescription drug medications?
Yes, I agree that making sure that everyone has access to the medications that they need is extremely important. I don't have a clear history of studying prescription drug costs, but I can say that in order for us to be able to maintain a healthy aging population, inadequate access to prescription drugs will undermine our efforts. The scientific advancements in pharmaceuticals are astonishing and playing a big role in helping with prevention at all ages. There's lots of room for pharmaceuticals to play a strong role in coordination with other healthcare efforts to ensure healthy outcomes. In terms of financial supports, it would be largely undermining to the efforts to ensure a healthy aging future if we did not have financial support for all of the pharmaceutical needs of older adults.
Thank you, Senator. Now, hear from